I thank you for your cooperation. I now invite the independent expert on the enjoyment of human rights by persons with albinism to make an introductory statement. Ms. Miti-Drummond, you have the floor.
Thank you, Madam Chair. Madam Chair, Excellencies, distinguished delegates, I'm honored to be here today to present my thematic report on the right to health and persons with albinism in the context of skin cancer. This report builds on the report of my predecessor in 2018 on the right of persons with albinism to the highest attainable standard of health. My report highlights the social determinants of health for persons with albinism and their specific health concerns, including visual impairment, particularly reduced visual acuity, nystagmus, photophobia, refractive error, foveal hypoplasia, optic nerve misrouting, and in some cases strabismus, as well as increased mental health concerns, the latter of which often results from widespread discrimination, exclusion, bullying, and microaggressions, leading to a form of racial and ableism-based trauma. Few persons with albinism, if any, receive psychological support for these experiences, including in relation to abductions, mutilations, and other physical attacks. The report further highlights the specific health concerns of those with rarer forms of albinism, such as Hermansky-Pudlak syndrome. In addition to a lack of melanin and visual impairments, persons with Hermansky-Pudlak syndrome have platelet dysfunctions, leading to prolonged or excessive bleeding. They may also experience gastrointestinal complications and lung disorders, with some having to receive double lung transplants. The focus of this report, however, is skin cancer. Due to a lack of melanin, persons with albinism are susceptible to skin damage from the sun and are particularly vulnerable in areas with high ultraviolet index and poor access to sunscreen. The various forms of skin damage include sunburn, photoaging, solar lentiginous, and aticaritosis, as well as skin cancer. Squamous cell carcinoma is the most common skin cancer in persons with albinism, followed by basal cell carcinoma and rare cases of melanoma. As the independent expert on albinism, I often receive information about skin cancer among persons with albinism, accompanied by photos of the individual in question with advanced tumors covering a large part of their face. I know for many, non-melanoma skin cancer is seen as highly treatable and not associated with death. However, when we are speaking about skin cancer among persons with albinism, we're not simply referring to small discoloration or a rough patch or spot on the body. Most of the time when I receive a report of skin cancer and such an accompanying photo, my heart sinks because I know that what will most likely follow, sooner or later, will be a death announcement regarding the same individual. Madam Chair, skin cancer is one of the highest causes of death among persons with albinism. In fact, it is now believed that more persons with albinism die due to skin cancer-related complications than to ritual attacks. The bulk of the research on this has been carried out in Africa and states that persons with albinism are up to 1,000 times more likely to develop skin cancer compared with the general population. And an estimated 98% do not live beyond 40 years of age if sun protective precautions are not adopted, with skin cancer being responsible for at least 4/5 of these deaths. Standing Voice, a civil society organization, reports that in Malawi and in the United Republic of Tanzania, a combined total of between 400 and 500 persons with albinism are referred for skin cancer surgery each year. In response to an informal survey carried out for this report, some organizations revealed relatively low rates of about 1% of known cases of skin cancer among persons with albinism. However, other organizations reported quite high incidences. The Burundi organization, for example, reported a high skin cancer incidence of 87.5%, being 28 out of its 37 members surveyed, while Cameroon reported an incidence of 53.3%, being 16 out of its 30 members surveyed. And it was not only African countries that reported cases of skin cancer. Countries in North and South America, Asia, and Europe also reported such cases. With the incremental rise in ultraviolet radiation and climate-related disaster, persons with albinism are disproportionately at risk of contracting skin cancer, regardless of their geographic location. This is a bleak and unfortunate reality which can and must be reversed to protect the albinism community globally. In light of the growing impact of skin cancer on persons with albinism, this year my focus was strongly on skin cancer. The theme for International Albinism Awareness Day was Demanding Our Rights, Protect Our Skin, Preserve Our Lives, a theme that highlights the urgent need to prevent skin cancer in persons with albinism. This year was also the year that my mandate collaborated with the Special Rapporteur on Climate Change, albinism organizations, and a dedicated group of scientists and activists to submit a joint application to the WHO to re-add sunscreen to the essential medicines list for persons with albinism. The application was a call for the highest global body on health to recognize that sunscreen can no longer be considered as cosmetics for persons with albinism, but as an essential life-saving medicine or drug. I'm proud to speak to you today, having had the application and thus the voices of persons with albinism and their organizations validated as of 5 September 2025, when the WHO finally agreed to re-add sunscreen to the essential medicines list. While this decision is most welcome and potentially transformative in the everyday existence of persons with albinism, its true impact can only be realized if member states demonstrate the commitment and political will to reconcile the gap of access and affordability of sunscreen with national health systems. Various international and regional human rights instruments guarantee the right to health and obligate member states to provide the necessary healthcare benefits, including preventive services. Moreover, member states have an obligation to mobilize resources for health access, including through international cooperation, and to ensure progressive realization of the right to health. Madam Chair, while my report clearly shows that we are at the cusp of a global health emergency for persons with albinism in the context of skin cancer, I recognize the encouraging developments in policy and good practice which provide some basis for optimism. In 2024, the Southern Africa Development Community adopted the Declaration on the Protection of Persons with Albinism, in which it called on member states to add sunscreen to their national essential medicines list. And at the beginning of this year, the African Court on Human and People's Rights noted in a pivotal judgment that lack of access to sun protection, including sunscreen lotion, constitutes the thin line between good health and serious infirmity for persons with albinism. There have also been some good practices which other countries can learn from. For example, Guinea, Panama, Brazil, and the US territory of Puerto Rico have adopted specific legislation on the rights of persons with albinism. These laws provide access to healthcare services for visual impairment and for skin cancer. Even before the WHO decision, Australia, Kenya, South Africa, and Tanzania had already designated sunscreen as an essential drug. Other countries, including Angola, Malawi, Mozambique, Uganda, and Tanzania, have adopted national action plans on albinism that include access to health care. In addition, there is mandated training of healthcare workers to understand albinism and improve health access in countries such as Fiji and the United Republic of Tanzania. I'm also encouraged by the private-public partnerships and the North-South collaborations, including of civil society organizations, in relation to the acquisition, distribution, and sometimes local production of sunscreen, which facilitate free access to sunscreen in many countries. I note, however, with great concern, the barriers to local production of sunscreen, including the bureaucratic regulatory processes, high cost of importing filters necessary to produce sunscreen with adequate sun protective factors for persons with albinism, and a lack of sustained government investment in production plans. Madam Chair, my report ends with a set of recommendations to be implemented by member states in ensuring the right to the highest attainable standard of physical and mental health. Most of these recommendations focus on what has become the silent killer of many with albinism, skin cancer. As with all concerns impacting persons with albinism, there is a deplorable dearth of official data and statistics on the impact of skin cancer on persons with albinism, despite the existence of international and national research programs on cancer in general. I implore member states to carry out the necessary research and data collection, which will enable appropriately targeted measures to be implemented. Furthermore, I call upon states to work with albinism groups in your country, even as we await the data, in the design, development, implementation, and evaluation of relevant programs. I take this opportunity to remind member states that a failure to prevent foreseeable and unnecessary deaths to skin cancer is not just a violation of the right to health, but also a violation of the right to life. I thank you all for your attention.
I thank the independent expert on the enjoyment of human rights by persons with albinism. I will now open the floor for any questions or comments to Ms. Miti-Drummond. As per past practice, I would ask the delegations to limit their comments to 3 minutes. I thank you for your kind cooperation. I now give the floor to the distinguished representative of Cuba, to be followed by the European Union.
Muchas gracias.
Thank you very much, Madam Chair. Cuba supports the mandate of the independent expert We welcome the report and we have taken due note of it. We welcome the international endeavors to avoid ill treatment, stigmatization, and discrimination affecting people with albinism. Activities of education and awareness raising in public opinion must continue at a global level. We have made progress, but not enough. As you recognize, Madam Independent Expert, in your report, in Cuba, health is a free and universal right. It's a right enshrined in our Constitution and one to which the state gives high priority. Although albinism is not frequent in Cuba, the rate is 1 per 19,000 births, our country is increasing its endeavors to protect the human rights of people with albinism. Here, the organization and projects of civil society are vital. The use of the hebaferrin drug, the result of Cuban biotechnology, improves the quality of life of the community of those who suffer from albinism in our country. This medicine is provided free to all those with an early diagnosis. It reduces the proliferation of vasocellular carcinoma, the most frequent type of skin cancer. People with albinism also have multidisciplinary care covering genetics, dermatology, ophthalmology, and psychology inter alia. All this has been done despite the vast restrictions that the blockade, the embargo causes in the Cuban health sector. Cuba will continue to share with other nations its experience and good practices regarding the protection and promotion of the rights of those with albinism, including through the altruistic cooperation we offer in Cuba since 1963. This has contributed to the promotion of health and welfare of millions of people in hundreds of nations, in particular developing countries. We invite the independent expert further to explore the positive impact of South-South and triangular cooperation when it comes to the full enjoyment of human rights by people with albinism. Thank you very much.
I thank the distinguished representative of Cuba. I now give the floor to the distinguished representative of the European Union, to be followed by Portugal and Bulgaria.
Thank you, Madam Chair. I have the honor to speak on behalf of the European Union and its member states. Madam Independent Expert, we warmly thank you for today's presentation of your latest report and reiterate our support to your work and mandate. As you rightly point out in the report, persons with albinism face specific health challenges and are highly susceptible to severe skin damage and the risk of developing skin cancer. This is often accompanied with increased mental health challenges as persons with albinism continue to face discrimination, stigmatization, exclusion, and violence. The EU stands with persons with albinism worldwide and will continue working alongside them to ensure the full enjoyment of their fundamental human rights. This requires addressing the significant barriers to the right to health, mainly due to the lack of specialized expertise, disaggregated data, and limited access to adequate healthcare and psychosocial support services. We therefore underscore the need to prioritize the accessibility of health services for persons with albinism and the allocation of resources to increase knowledge and expertise within the medical field so that their specific needs are properly met. The EU strongly advocates for the implementation of laws that guarantee the protection of persons with albinism and their full enjoyment of the right to health. Awareness measures, skin care screening, access to sunscreen and protective gear, as well as mental health support can be life-saving for persons with albinism. In this regard, the EU commends the adoption of national and regional action plans that include such measures and initiatives. 10 years after the creation of the mandate on the enjoyment of human rights by persons with albinism, we recognize the progress achieved in the last decade. However, we also note that significant challenges remain. Madam Independent Expert, how can the EU's development and global health partnerships be used more effectively to support the health and protection of persons with albinism in partner countries? I thank you.
I thank the distinguished representative of the European Union. I now give the floor to the distinguished representative of Portugal, to be followed by Bulgaria and China.
Mr. Chair, Portugal thanks the independent expert for her important work, including our latest report on the enjoyment of human rights by persons with albinism, with a particular focus on the right to health in the context of cancer. Albinism entails increased vulnerability to sun-related health complications, including life-threatening forms of skin cancer, particularly where access to healthcare is limited. These risks are further aggravated by the social and economic exclusion that many persons with albinism continue to face. Madam Independent Expert, your report highlights the need to act on multiple fronts, from improving access to sun protection measures to addressing the lack of data that continues to hinder effective policy making. We therefore welcome its emphasis on strengthening public health systems and on integrating preventive care, early detection, and treatment of skin cancer into broader national health strategies. Beyond physical health, the psychosocial dimension is equally critical. Combating stigma and discrimination requires awareness raising and education initiatives to challenge harmful beliefs, legal protection against hate crimes, and access to mental health support. Portugal remains committed to supporting efforts aimed at promoting public policies that ensure the full enjoyment of all human rights by persons with albinism. In this context, we look forward to the visit later this month to Portugal of Madam Independent Expert, which we view as an important opportunity to engage in a constructive dialogue, share national experiences, and further strengthen cooperation in advancing the rights of persons with albinism. Madam Independent Expert, in your view, what avenues of international cooperation could be further mobilized to improve access to both preventive care and mental health support for persons with albinism? Thank you.
I thank the distinguished representative of Portugal. I now give the floor to the distinguished representative of Bulgaria, to be followed by China.
Thank you, Chair. Bulgaria aligns with the statement delivered on behalf of the European Union, and I wish to add a few remarks in my national capacity. We thank the independent expert for the presentation of her report and express our full support for her mandate. Bulgaria remains concerned by the persistent discrimination and violence against persons with albinism who also continue to face serious health challenges, including heightened vulnerability to skin cancer, and who are often affected by limited access to healthcare and psychosocial support. We underline the need to ensure accessible health services, raise awareness, and provide essential protection such as sunscreen, clothing, and also mental health support. We also stress the importance of implementing national and regional action plans to guarantee the inclusion and protection of persons with albinism, and commend those who have already implemented such plans. A decade after the establishment of this mandate, we acknowledge and commend the progress achieved, but also note that significant challenges remain. Bulgaria reaffirms its commitment to promoting equality, inclusion, and dignity for all persons with albinism. I thank you.
I thank the distinguished representative of Bulgaria. I now give the floor to the distinguished representative of China.
Madam Chair, the Chinese delegation has taken note of the report by the independent expert on the enjoyment of human rights by persons with albinism and listened attentively to her statement. We express our gratitude for the digital efforts to protect the rights of persons with albinism. China has also taken note of the thematic study on the skincare and albinism. As an equal member of a society, persons with albinism should enjoy equal protection of all their rights, including the rights to life, liberty, and physical security. Meanwhile, as a vulnerable group, they should receive greater recognition and care. Respecting and safeguarding the rights of people with albinism embodies social fairness and justice. Since 2018, the Chinese government has classified albinism as a rare disease, supporting related research and incorporating rare disease medications into the medical insurance catalog to facilitate patients' access to healthcare resources. In the future, China will continue to provide greater support for individuals with albinism. China also calls on the UN and the nations related to adopt concrete measures to enhance the proper understanding and the protection of legitimate rights of individuals with albinism, eliminate discrimination and abuse against them, and earnestly respect and safeguard their human rights and personal dignity. This will promote their equal integration into society, their right to enjoy a fulfilling life, and enhance their well-being. Thank you, Chair.
I thank the distinguished representative of China. I now give the floor to the independent expert on the enjoyment of human rights by persons with albinism, Ms. Muluka-Anne Miti-Drummond.
Thank you, Madam Chair, and thank you to all those who have engaged with the report and contributed with your questions and your engagement here today. I would like to agree with a statement made by Cuba that awareness raising is essential. It is essential to carry out awareness raising, and that will help in tackling stigma and discrimination, including attitudinal barriers within the healthcare system. In carrying out the report, these attitudinal barriers were raised as one of the main concerns for persons with albinism when it comes to accessing treatment for symptoms of skin cancer or what appears to be skin cancer. Apart from attitudinal barriers, it was also the lack of understanding by persons with albinism of their own condition and their vulnerability to skin cancer, and lack of understanding of the importance of sunscreen, the need for sunscreen. So awareness raising is essential in raising awareness for persons with albinism about the importance of sunscreen, raising awareness with healthcare actors that spots or discolorations on the skin is not a natural part of having albinism. It may actually indicate a skin cancer or potential skin cancer diagnosis, but many stated that by the time they are diagnosed, it's already too late, and they're only diagnosed when it's extremely severe. In relation to international cooperation, yes, international cooperation is essential not only in the production and distribution of sunscreen, but also in carrying out research, particularly as well in regards to the rarer forms of albinism, such as Hermansky-Pudlak syndrome. I think very little is known about this, and in some countries, people are not even tested to understand whether they have HPS or not, and it is essential that we start carrying out genetic testing, because this may help in preventing further complications for persons who have HPS. With regards to local sunscreen production, this is an essential part, but there's so many bureaucratic hurdles that happen, and I would like to call on governments to remove these bureaucratic hurdles, to ensure that import duty on the ingredients for local sunscreen production are removed, and to invest in local plants for production of sunscreen. Public-private partnerships and partnerships with civil society organizations, North-South partnerships, are essential in also distributing sunscreen. Sometimes local production is not possible, but I recognize the organizations and the private companies as well that have contributed sunscreen to different countries as well to assist persons with albinism. I would call on states to invest in training of medical specialists and ensuring that they are sufficient medical specialists, not just dermatologists. Ophthalmologists are essential, and as I've mentioned, and oncologists as well. And as I've mentioned, HPS, in relation to HPS, hematologists, pulmonologists are also essential, and we need to ensure that there's training of these. Regular skin cancer screening as well can make the difference between life and death for persons with albinism. Being able to detect skin cancer at an early stage can prevent the situation from getting extremely bad. The representative from the EU also asked about what can be done to assist in reducing the health concerns. I would like to point out something that I say almost every time that I'm here: the lack of data. Data. It is essential that we have data on persons with albinism. Someone once said that you don't count if you're not counted. And a lot of times we are told there are very few people with albinism, or we do not have people with albinism in our country. But the truth is, many states don't know if they have people with albinism because they have not taken the time to carry out the research. So I would encourage that research is done to understand the extent of skin cancer and other concerns of persons with albinism in your countries. In fact, in many cases, we see that skin cancer prevalence among persons with albinism is much, much higher than any other cancer prevalence in the general population. I'd also call on states that have very good welfare policies, disability allowances, to recognize that actually albinism is a form of disability and that persons with albinism should access these disability allowances. And this should include allowances for things such as sunscreen and accessing sunscreen and other reasonable accommodations and assistive devices. The lack of recognition of albinism as a disability prevents persons from albinism in accessing the welfare benefits that they have in the country. Finally, I would also like to refer to issues of mental health. Thank you for those, for Portugal and Bulgaria and other countries that mentioned mental health. It is a huge concern and it is something that we cannot continue to overlook when it comes to persons with albinism, and we need to invest in that. I would also just want to acknowledge Portugal and thank them for the invitation and for the country visit that will be taking place in a few weeks to Portugal. Yes, and then with regards to laws, I have indicated countries that have specific laws, but at the same time, what I would like to say is what is important is implementation of laws and application of laws to persons with albinism. So many countries have existing laws that are applicable and that can support the rights of persons with albinism, but do not apply these laws to persons with albinism. So I would also encourage countries to specifically look at albinism as a disability, consider the specific needs of persons with albinism, and apply existing laws to persons with albinism in the country. Thank you.